Okay, hello. We are going to go ahead and get started. So this shouldn't take very long. I just want to give an overview or an introduction to what functional medicine is, what the process looks like, who it might be great for, and kind of the differences of maybe what you've received in the past when it comes to medical care or chronic disease care, whatever it might be. So I'm Dr. Rachel Waniger. I am a functional medicine certified practitioner, and I work at Delta Health. We have chiropractors, massage therapists, and I am the functional medicine doctor. So, general overview of what is functional medicine. It is very much root cause, whole systems approach to chronic disease, chronic symptoms. So we really feel like in modern medicine, or in traditional medicine, we operate our medical field in silos. There's cardiovascular, there's GI, there's neurological, but our body doesn't operate like that. It operates together and everything influences one another. So that's something that we really take into consideration and really focus on with functional medicine, is that the body, it all works together and we have to treat it like that. Root cause, why, you'll see on this slide bolded, because those are kind of even the buzzwords behind functional medicine, but it is truly that. It's figuring out why people are experiencing whatever symptoms that they're dealing with, whatever diseases that they're dealing with. There's always a reason the body might become imbalanced or there's symptoms. It doesn't just happen. There are always reasons. And so I'm always asking why. I'm always asking why they're having those symptoms. But then when they have lab values that come back abnormal, I'm also asking why those are abnormal as well. So it's always why. And then to help really people heal from the inside out, it's about empowering them to do the things and give their body the things that it needs to do what it's supposed to do. So I really like to work with patients one-on-one to find what works best for their body so that they feel good and that it can operate the way that it's supposed to. Okay, what can functional medicine help with and who? So you'll see kind of a long list over there, and it is true. The list is not even comprehensive. Pretty much any sort of chronic disease or chronic issue that isn't resolving or, is just being managed with medication or symptoms that you can't get answers to or you can't get a diagnosis to. That's what functional medicine is here to help with, whether it's hormones, fatigue, gut issues, skin issues, immune system irregularities, metabolic issues with cholesterol or high blood pressure, anxiety, depression, migraines, headaches, a lot of the neurological side of things as well, or chronic infections or chronic toxicities. It can really help with all of that. I also love just helping people optimize their health. I have plenty of people that come in and they just want to get a full blood panel. They want to figure out what they need to do diet-wise, lifestyle-wise, and supplements to really optimize them, and then really tailor that specifically to their history, their story, but of course their lab results as well. So who can it help with? I mean, pretty much anyone. I don't have a specific niche that I work with. I love all ages. I love all genders. So it's pretty much anybody that wants and needs that kind of help and has that desire to work on themselves and to get better is exactly who functional medicine can help with. Okay, so people always want to, kind of know what the process looks like, because it can look different in different offices. So I always start with an initial visit where we sit down and we go through your whole history, your whole story, to get all that information. So the two big pieces to finding out kind of root cause or why behind whatever issues you're dealing with is the initial visit of hearing your whole history and then lab values. So both of those are equally important. Sometimes somebody's history can give even more information than their labs can. And then sometimes with patients, it's, the other way around. So first visit is always hearing that whole story. Very, very important part. After that, we decide what labs we want to do. Everything that I do here is very tailored specifically to that patient. So that's why I like to decide or not do blood draws until after talking to the patient, because there's different things we might want to draw or different tests outside of blood work that we want to do as well. After we decide what labs we want to do, the labs get done, and then we come back in and we will go through all of the labs top to bottom. I will tell you everything that I'm seeing, everything that I'm interpreting from that, and how that of course relates to your symptoms, your history, how that relates to the rest of the labs and things like that. At that appointment, we would also go over your care plan or what treatment looks like. I kind of like to say the three legs of the stool when it comes to functional medicine treatment is diet changes, lifestyle changes, and then supplementation. So again, truly helping the body get to a state of where it's supposed to be to do the things that it's supposed to do. So correcting deficiencies, lowering inflammation, healing our gut, managing stress and adding in anti-inflammatory things are big pieces of what goes on with functional medicine. But again, truly healing from the inside out. Beyond that, it really depends on the patient. I will usually check in with patients down the road, maybe 4 or 5, 6 weeks. What's working, what's not working, how do we keep improving? Kind of that health coaching type session. We'll make treatment changes, we'll tweak supplements, things like that. But it is a really great way to touch base and kind of continue, the path. But again, everybody's different. So some people will see me monthly for a couple months. Other people will wait a couple months because they have a better grasp of what they're doing. And of course, depends what the patient has going on as well. And kind of follow that up. It is pay as you come. I don't have any programs that you buy onto or anything like that. Again, everybody's so different. So their care plans are going to look different, and how often they see me is going to look different, and they've got different things going on. So it all just kind of depends on the patient. There's no insurance. They do not cover what I do. People are always asking about that. HSA and flex spending usually always reimburse. So that's always a great option. People use that all the time. There's some pricing. If you book online, there's some information there. But if you want to talk about more specifics of what that might look like, again, everything depends on the patient. Then you can set up that free 20-minute intro visit where you go through a lot of this kind of stuff that I'm talking about today, but maybe a little bit more specific to you and what that might look like. Okay, so a big difference with functional medicine is the testing and kind of what we look into. The comprehensive history is a big difference as well, but people like to kind of see what that looks like when it comes to testing. And so on the right there, I have an example of a blood test result. That's only one page. That's about actually maybe a third of what I run on a normal blood panel, but it's the first page of it. And so I like to kind of give a visual of what that looks like. So it gets put into this nice functional health report. And if you see on the right side there, let's see if my mouse shows up, but you've got standard range and optimal range. So standard range is what traditional medicine is going to use and focus on more often. But there's a lot of research where healthy people actually fall, and that's going to be your optimal range. So we can get a lot more information on dysfunction when it comes to patient issues. So this is where oftentimes, I get my labs drawn, but everything comes back normal, but I do not feel normal. Or, it's just a matter of we're not looking necessarily for disease, but we're looking more so for dysfunction. I like to call your standard range your surviving range and the optimal range your thriving range. And with functional medicine, again, we want to optimize and we want to help people thrive. So color coordinates that really nicely and puts it all into one spot, and you can kind of compare the ranges side by side and get a lot of great information. We're also going to test a lot more. So there's not just, your classic CBC and CMP. It's looking at all kinds of different things for micronutrient levels, inflammation levels, toxicity, liver status, full blood sugar panel. Again, beyond just glucose and even a hemoglobin A1C, we're looking at the immune system more comprehensively, a full thyroid panel, hormones, and the testing world is vast, so we can do a lot, but that's of course always the base because we have to look at, again, a wide lens view into the patient and see a lot of what's going on in all their different body systems. And kind of like I talked about earlier, it's all connected. Our bodies don't operate in silos. So it's one big puzzle to put all those pieces together. And that's kind of the blood work, but then of course your history too. So how does the blood work relate to the rest of the blood work? How does that relate to your symptoms? How does that relate to your history? So on and so forth. I do all kinds of other specialty type testing. Those are a little bit more narrow focused. It can be a stool test if we need to dive into GI issues, autoimmunity, skin issues, things like that. The gut reveals a lot there. More advanced hormone testing. We can do more cortisol, adrenal stress response testing, heavy metals, mold, and others. But that blood panel can be a great place and often a place where we always start because, again, it's going to look at a lot across the body. So truly what the functional medicine differences are, again, we're always asking why. There is always a reason something goes wrong in the body. There is a reason we have an imbalance. So we have to always dig and find out why. So it's not just a matter of, adding a prescription to band-aid the symptoms. It is truly figuring out why that imbalance is happening, why you have that symptom, and then correcting it so that the body can not have that symptom or show that symptom any longer. So band-aid solutions are not long-term solutions. And I am always wanting to help people have long-term solutions, but again, optimization and help them feel good. The practitioner-patient partnership. So that could say relationship too, but I really like to emphasize the partnership because it's not just me telling people what to do. It's the patient also giving me feedback on things that work best for them. We're always working with one another on how to optimize them. It's not just me telling people everybody's so different. So if I just gave everybody the same protocol or just told them exactly what to do, people would not be successful. We have to really tailor what's going on with you and with the patient. And then of course, what your labs say and what your life looks like and what your family life looks like. So what somebody's doing for treatment is going to look completely different than somebody else just based on what they got going on, but what their life is like and what they can manage and what they can handle. So it's, I've had people say, it feels like a friendship sometimes just because of how much you work with each other. And again, it's teamwork. It's very much teamwork. It's a partnership. And this has been mentioned a few times, but everything is individualized. So testing is individualized. Again, we have to hear everything that's going on with you before we decide what we're even going to test, because that varies by the person, what would be most beneficial to look at. And then everything that we do treatment-wise is individualized as well. I don't wish my job would be super boring if I could just give everybody with bloating the same protocol. It doesn't work like that. People won't get better, or maybe 10% of people will get better, but 90% won't. So everything that we do is very individualized to the story, to the patient's life, and then of course their lab results. And I think that's a big difference with functional medicine, rather than just trying to throw, again, medications on top of something, whatever depression diagnosis it is. There's so many different reasons why someone might have depression. So just throwing an antidepressant at it is a Band-Aid solution, but it's not individualized. So those are just kind of some differences and some examples of what makes functional medicine different. And in my opinion, the go-to for anything chronic and chronic disease, chronic symptom, whatever it might be. Okay, so I hope that gave a really good overview of what functional medicine is, what it entails, who it can help. But if you feel like you need to ask more questions or figure out a little bit more how it might tailor specifically to you, I do offer a free 20-minute introductory visit. We would talk a lot about the things that I just talked about, but again, sometimes people have a few other questions. You can always schedule online through our website at deltadsm.com or call into our office. It's 515-278-2782. So I hope you enjoyed and hope you learned some things, and let us know if you have any questions.